Hello and welcome to the RWJF Culture of Health Prize Insights webinar. This is Carrie Carroll speaking. We're coming to you today from the University of Wisconsin Population Health Institute in very snowy Madison, Wisconsin. I am joined today with my colleague Olivia Little. Some of you may have connected with Olivia either virtually or via phone as you were applying for the RWJF Culture of Health Prize.
Hi everyone, welcome.
We'd like to start today by acknowledging that the Culture of Health Prize is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute, which is also the home of County Health Rankings and Roadmaps. We are partnering together with others to help build a culture of health across the country. Next, we wanted to take a moment to orient you to the technology we're using today. The GoToWebinar interface is made up of two parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. If you're having challenges with the technology and want to ask us a question, you may do this via the control panel, which is on the right-hand side. We've reserved time at the end of the presentation for questions. The slides for this webinar are available in the handouts section of the control panel. And a link to the recording of the webinar will be emailed to you following today's webinar. Next, we really want to thank you all for submitting your prize application. It's our hope that the time you and your colleagues and your community leaders invested in writing your prize application really did offer you valuable opportunity and time for collective reflection. This webinar is an opportunity for us to share some of the insights we gained in reviewing prize applications, and we really do hope that you will hear your community reflected in the comments. Thank you so much for those that submitted questions when you registered for this webinar. We've designed this presentation with those questions in mind, and we will cover three topics. First, we'll start with a quick review of the 6 prize criteria. Then we'll share insights from the applications. We'll talk about both strengths and limitations. And we'll even provide you with a few actual comments written by judges as they were reviewing some of the applications. And then we'll point you to some helpful tools and guidance available through the County Health Rankings and Roadmaps, including how to access some free coaching services available to communities at no charge, thanks to the Robert Wood Johnson Foundation. The prize is a key part of RWJF's national vision to build a culture of health. Building a culture of health means that we are creating the conditions that allow all in our community to lead healthier lives now and for generations to come. It means knowing that health is greatly influenced not just by what happens in the doctor's office, but by where we live, how we work, and the safety of our surroundings, the strength and connectivity of our families and communities. The prize recognizes that every community is on a unique journey toward better health, and prize-winning community stories are as diverse as our nation's populations. So this is why we enlist more than 30 experts from 3 different national organizations to review the 188 applications we received for Phase 1. Each application is read by 3 different judges to ensure the review process includes diversity of perspective. The first phase of the prize emphasizes the first 3 prize criteria, and at this time I'd like to invite Olivia to walk us through these critical areas of the prize, the elements of the prize, and really what all applications must reflect. Olivia?
Thank you, Carrie. As Carrie mentioned, the applications are judged based on how well they represent all 6 of the prize criteria. These really serve as a lens through which all applicant communities' submissions are judged throughout the whole process. And they focus on both what communities have done as well as how they have done it. And for phase 1 application, judges were instructed to focus primarily on the first 3 criteria, which I will now overview. The first criterion is defining health in the broadest possible terms. So building a culture of health really means using diverse strategies to address the multiple factors that influence health. And when we say multiple factors that influence health, we're referring to this comprehensive picture of health that underpins the County Health Rankings and Roadmaps program. This picture really encompasses a broad, holistic view of health, one that lays out many factors that lead to good health in a community and goes beyond just what happens in healthcare settings. It also points to areas of action that communities can address to improve health outcomes. So just to walk through the picture a little bit, in the green boxes at the top, you will see the health outcomes, and 2 overarching health outcomes we look at are length of life. In other words, are people living a long time, or are they dying too early? And quality of life, how well people feel while they're living. In the blue boxes, you find the health factors that affect these health outcomes. These include health behaviors, clinical care, social and economic factors, and the physical environment. And the blue boxes are things that communities can work on now to help improve their future health. That's a lot of what we focus on here. And the orange box as well at the bottom shows how policies and programs impact health factors and ultimately health outcomes. So prize applicant communities are encouraged to share how they're bringing this picture of health to life in ways that demonstrate responsiveness to their community's needs and assets and priorities, and in ways that feature policies and programs that address factors across the model. And just as a note, as you see, social and economic factors have a strong influence on health outcomes in this model. So judges have a particular interest in accomplishments that exemplify specific actions that communities are taking to improve social and economic factors such as quality of schools, economic development, and increasing neighborhood safety. In fact, one of the questions that we got during registration were what were some of the reasons that applicants were not chosen to move forward into phase 2. We'll be discussing that in a lot more detail later, but I'll just note that phase 1 applications that focus entirely on clinical care or health behaviors don't tend to be competitive in the process. And that's one of the common reasons that phase 1 applications don't move forward. And while we highly value work in these areas, judges are looking for applications that exemplify a balanced portfolio of activities across these health factors that you see here. Our second criterion is committing to sustainable systems changes and policy-oriented long-term solutions. So this means making thoughtful, data-informed, and deliberate policy, programmatic, environmental, and systems changes. So having an eye toward ensuring the sustained impact of your changes over time. Applications should include information on what policy, environmental, and system changes you have in place and how those changes reflect a common agenda that is intentional, data-informed, and coordinated across the community. And judges are interested also in the data and evidence base that you use to make decisions. So in other words, how is the community focusing its efforts, and how do you know what's working? Our third criterion is cultivating a shared and deeply held belief in the importance of equal opportunity for health. And this criterion asks you to share how you're putting health within everyone's reach in a way that all individuals feel they can have a voice and a role to play in improving health. So for one, how are you identifying and addressing gaps in opportunity that tend to disproportionately and negatively affect certain populations, for instance, racial ethnic minorities, people with lesser income, people with disabilities, and so forth. And it includes also fostering a community where all people feel a sense of security, belonging, and trust, approaching problem solving collectively in a way that values the perspectives of the community as a whole. So importantly, this criterion is also asking how you are authentically engaging with community members, especially those that are most impacted by poor health. in both designing and implementing solutions. I'll turn it back to Carrie now to talk about the other 3 criteria.
Thanks, Olivia. So judges also look during the phase 1 review for areas where they see notable strengths in the next 3 criteria as well. So harnessing the collective power of leaders, partners, and community members. This includes developing strategies for buy-in, decision-making, coordinated action, and demonstrating how business, government, individuals, nonprofit organizations are working together to improve health outcomes. The 5th criterion asks, are you using all of your resources in your community? And do you align and mobilize financial and non-financial resources, such as the talents from the community, the business community, human capital, natural resources? So a broad definition of resources. And last but far from least, we ask communities to tell us about how you measure and share your progress. How do you demonstrate and communicate your commitment to quality improvement and impact both process and outcomes? How do you agree on and define success based on shared priorities community-wide? I'll turn it back over to Olivia now to ground us more in what a competitive application requires. Olivia?
Thank you. So one key point that we want to underscore first is that the prize recognizes whole communities. So applying for the prize requires thinking beyond your own individual organizations and initiatives and to really consider what has been accomplished across the entire community. So judges are looking to see the bigger picture of your community and how it's part of a grander connected whole. So while we can't point to a magic formula of accomplishments that makes a prize application successful, but this approach of the bigger picture and the connectedness shines through in applications of communities that are moving forward to phase 2. So what we want to do now is look at some of the strengths of the applications that were most highly rated in the review process. So judges, after they had completed their reviews and we looked at the applications that scored the highest among the phase 1 applications, judges brainstormed together about what the strengths of these applications were. And as you'll notice as I start to go through this list, they virtually mirror the prize criteria that we've already reviewed, sort of underpinning that these are really foundational to our process. First, applications that are moving forward to phase 2 exhibited excitement about a culture of health and an understanding of the wide range of factors that influence health, as indicated in that county health rankings model that we just talked about. So successful applicants presented a broad ways of thinking about and addressing health. They are addressing multiple factors across the model, including health behaviors, clinical care, social and economic factors, and the physical environment. And as I mentioned, successful applications also included a significant focus on social and economic factors. One distinction that we really saw here was that these applicants weren't just targeting programs and services to individuals in poverty, for instance, but they included how they were addressing deep-seated social and economic issues, such as through improving income and employment, through a better quality education, better family and social support, and community safety. So they didn't over-rely on accomplishments that only targeted health behaviors or clinical care. Here are a couple of representative comments that judges made on highly rated applications. The application presents a diverse range of accomplishments that attend to the multiple determinants, including workforce training, prenatal care, housing and social connectivity, and small-scale revitalization. And the community demonstrates a broad definition of health that's reflected in work to address economic development, housing, transportation options, education, and diet and exercise. And then moving on, mirroring criteria number 2, there was significant focus in this set of successful applications on addressing issues through policy, systems, and environmental changes. So this includes accomplishments that go beyond establishing individual programs and providing services, and 2, changing policies and systems. Sometimes that's at the level of government, but that also can be at the organizational level, but in ways that promote and sustain a culture of health for all. So by this, we're referring to changes such as tobacco policies, food ordinances, housing and construction, physical environment improvements, such as perhaps sidewalk improvements, trail systems, things like that, education and job policies that promote growth and economic security. And again, here are a few examples that judges noted from highly rated applications. This community is using data to drive policy, systems, and environmental changes that include changes to housing construction policy, community engagement and neighborhood revitalization, and creating a job talent pool to support industry growth. Or they show strong policy systems and environmental change examples, including Health in All Policies framework for county government, complete streets, safe routes to school, and a collective impact approach. And our criteria number 3, cultivating a shared and deeply held belief in the importance of equal opportunity for health, was really an especially strong criteria for judges this year. Standout applications would discuss a strong commitment to health equity and describe their efforts to authentically engage all community members to create change. We heard examples of how communities are building a stronger sense of cohesion and interconnectedness among their residents, and how they're fostering change from the ground up in ways that value the voices of residents at all levels of the community. Judges noted examples such as, this community recognizes that despite its many assets and public recognition, a culture of health can't exist when pockets of poverty and poor health still exist in specific neighborhoods and populations. Or, excellent example of a community that has authentically engaged residents, including youth and historically marginalized populations, in identifying and implementing sustainable approaches to improving health. So these mirrored the first 3 criteria, but there are also several strengths that judges noted which cut across all 6 criteria, and Carrie will now talk about some of those.
Judges saw evidence in successful applications of a commitment to leveraging resources. Many applications offered how they have an eye toward maximizing value. There were examples of resourcefulness that went beyond the local level to state and federal dollars, as well as creative approaches to thinking about resources in the very broadest sense. Judges also appreciated the innovative and out-of-the-box thinking on how to address pressing health issues and build a culture of health. They really do look for a balance between evidence-based efforts and innovation. A couple of comments representative of these strengths are, one judge said, they are very focused on coordinating and integrating services to build on existing assets and avoid duplication of resources. Another judge said of an applicant, strong use of resources, including but not limited to multiple foundations, significant public and private fundraising efforts, and efforts to engage their community members. So in a broad sense, successful Phase 1 applicants provide judges with a deeper understanding of their community and where their community is on their journey toward a culture of health. They demonstrate well what they've accomplished and how that's equally important as how they're going about their accomplishments. So now let's turn to what judges saw as limitations in applications. Please keep in mind we have an extremely wide variety of applicants, and all of these limitations may not apply to your application, but we do want to talk through a few of these. First, we recognize that there are many ways to define community in this diverse country of ours. However, the prize call for applications required communities to define themselves in very specific terms. So as either a town, a city, a county, a tribe, or a region. So if your application featured the work of a single organization, the application would not have advanced, for example. Breadth across accomplishments really is at the heart of the prize competition. As you contemplate a future submission, and we hope you do, we encourage you to keep this top of mind. We received a good number of applications that showcased very impressive accomplishments. However, they were just too narrow in scope to persuade the judges. Sometimes the application spoke only of a single health problem or a single health issue. Maybe it was obesity or food security. Other applications may have been too narrow in how they centered on the health factors. Some applications really only wrote about health behaviors, or all clinical care examples were provided. Olivia stressed earlier the influence of social and economic factors on health, and we did see limitations here. If you tell us in your introduction that social and economic status presents the greatest challenge to your community, we really do want to hear what you're doing to address the root causes of poverty. Applications were sometimes limited in how they presented accomplishments that were largely programmatic in nature. These applications didn't score as high as those that talked about thoughtful and deliberate policy, environmental, and systems change efforts. Programs are really important, but they should be a part of a larger environmental and systems change strategy. And sometimes people hear policy and they think that means changing laws, and it can, but there are other types of policy, and some applicants demonstrated success with policy changes within organizations, for example. Others pointed to community-level policy changes through local legislative processes. And finally, some applicant communities presented many accomplishments that were only in the early planning stages or were just being implemented. And judges saw a lot of exciting accomplishments that are still early on. If you have these, you may be a very strong prize applicant in the future as your plans are implemented and your program strategies and policies unfold. A question we often get from communities is, how can we enhance our current initiatives? As you can tell from the application strengths we discussed today, the prize criteria are really important. And you can use these criteria not just in preparing your annual application for the prize, but as a lens through which your efforts to improve health in your community on a daily basis. So at this time, I'll pass it back to Olivia to tell you more about some of the helpful tools and guidance that are available through the County Health Rankings and Roadmaps program.
Great, thanks. So I'm just going to overview some of these resources that might be helpful to you all, as Carrie mentioned. As many of you know, the County Health Rankings provide a data snapshot of your community's health and a starting point for investigating and discussing ways to improve health. The County Health Rankings are released annually, and you can use your county's ranking as a call to action to engage stakeholders from all walks of life. To find your county snapshot, you can go to countyhealthrankings.org, seen here, and select your state from the map and then your county. And from your snapshot, you should be able to review data that's used to calculate your county's current rankings across multiple health factors and outcomes. And just as a note, the 2016 rankings release will be on March 16th, so right around the corner. And in addition to the rankings, I'd like to highlight several resources that can help you move forward from data into action, where I know a lot of you are already going. First, I'll direct you to our Poised for Progress tool. This is a self-assessment based on the 6 prize criteria, and it asks a number of questions to help you identify your strengths, for building a healthy community, and then where more focused effort might be needed. So a link to this tool is at the bottom of the slide. And as you consider how you can continue to strengthen and enhance your efforts, this Poised for Progress tool can help you approach your work through the lens of the prize criteria. And what's really nice about the tool is it also provides links directly relevant, provides direct links to the relevant guidance that's available in the Roadmaps to Health Action Center. The Roadmaps to Health Action Center has developed out of the county health rankings as a way to help communities improve their health factors and outcomes. It's based on the Take Action cycle that's shown here. So the Take Action cycle is the how within the rankings and roadmaps, and it lays out the process that communities can take to improve health. So all the steps are around the circle. For instance, gathering information to assess needs and resources, set priorities so you can focus on what's important, find the most effective approaches to address your priorities, and then get to work, act on what's important. And of course, evaluating throughout the cycle will help improve your strategies and ensure that what you're doing is effective. You'll see that the communicate circle goes all the way around this Take Action cycle because communication with stakeholders is essential throughout the Take Action cycle. And at the heart of the Take Action cycle is community members surrounded by multiple sectors that need to work together, because we know that solving complex issues like childhood obesity or low graduation rates or poor access to healthcare requires the wisdom and resources of everyone in the community. So for many of you, the steps laid out here may be familiar. The Roadmaps to Health Action Center also provides step-by-step guides and tools to help communities move to action. Just to show you where that is on the website, using the Roadmaps to Health drop-down menu on the orange navigation bar at the top of our site, you can quickly navigate to the Roadmaps to Health Action Center. And here you'll find interactive guides and a variety of tools to assist communities. From the Action Center homepage, you can simply click on any step in that Take Action cycle. They're all live links. Or you can click on any of the stakeholder groups and it'll take you to a page to learn more. So for example, if I click on Work Together, you can see that each step is broken down into key activities. And if you click on any of those key activities, you'll find related guidance and tools to help you. So this first one, if I clicked on the first one, there's a whole range of tools and guidance there to help you. So there's really a wealth of information here at the Action Center website that we encourage you to look through. The County Health Rankings and Roadmaps program also offers community coaches who are available to consult with communities about how best to move action forward in your community. There are community coaches located across the nation, and thanks to funding from Robert Wood Johnson Foundation, they're able to provide assistance at no cost to you. Community coaches provide community leaders with direct support to strengthen their capacity to advance health improvement efforts in communities. Our coaches use the County Health Rankings model and the Take Action cycle, the RWJF Culture of Health prize criteria as frames for their guidance, as well as all of these great tools within the Action Center that we're overviewing. And you'll find these little orange Get Help boxes throughout the Action Center inviting you to contact the program for personalized free help. That's the best way to connect with one of our community coaches. So please don't hesitate to contact one of our coaches if you need assistance with the tool or have a question or are figuring out the next step in your process. We really encourage you to take advantage of these great resources. And to talk about a few of the other helpful resources and tools available on the site, I will turn it back over to Carrie.
So also on countyhealthrankings.org, there is a tool called What Works for Health. And you can get to What Works for Health by using the Roadmaps menu on the navigation bar. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, systems changes that will improve the variety of factors we know affect health. What Works for Health is an easy-to-use, searchable menu of solutions for the specific problems you are targeting. And to learn more about strategies that could work in your community, you can select a health factor of interest, so the light blue boxes on the far right, and browse through the evidence ratings for strategies that address that particular health factor area. Each strategy is rated based on its evidence of effectiveness. And we offer a webinars series. If you would like a more comprehensive overview of the County Health Rankings and Roadmaps program, please do check out our archived Rankings and Roadmaps 101 webinar. The last one was held January 12th. These are recorded and posted on countyhealthrankings.org. And we will go ahead and chat out a link to that webinar now. We hold regular webinars exploring how communities are building a culture of health, and there are 3 coming up that you really will be interested in, I think. The first one is on data. It's called Data in Depth, Making the Most of Your Rankings Data. That's coming up on January 19th. There is one on February 9th called Rankings in Action, Opioid Overdose. And then I know we talked about community engagement earlier. On March 8th, there'll be a webinar called True Community Engagement, and that will be featuring one of our 2015 prize winners. We also wanted to alert you to some other resources today that may be helpful for your communities. For example, the Robert Wood Johnson Foundation, in partnership with the Reinvestment Fund, has announced something called Invest Health, which is for mid-sized cities, but there is a webinar tomorrow, January 15th, and we'll chat out the link to that if you want more information on Invest Health. And always we recommend signing up for the RWJF Advances newsletter, which is on this slide. That will include funding opportunities on a regular basis. There's also the County Health Rankings and Roadmaps e-newsletter that you can subscribe to, and you can follow us on Facebook and Twitter. And Olivia mentioned that the County Health Rankings will be released this year on March 16th, and the prize call for applications for next year will be opening this summer for 2017. So I know we've had a couple of questions come in already via the chat. You are welcome to do that. One question we had submitted in advance, someone asked, I'm interested in the geographic scope for successful applications and whether a broader or more specific application is most successful. What I would say to that is that the geographic scope of your application should probably reflect the scope of your partnership work. We've seen competitive applications from expansive regions cutting across 2 states, and that was a strong application. Even though the geography was so vast, it was strong because the efforts featured in the application authentically reflected how the community works together. We've also had applicants progress in the competition who were from extremely small communities. So again, there's no one way to become a successful RWJF Culture of Health Prize applicant. Olivia, do you have any other questions coming in?
Hi, I saw that one question came in while we were speaking that that Carrie answered, and I'll raise that for the rest of the audience, which is, did geography have any bearing on selection? For example, if a state had multiple winners in the past, would an application not have been as strongly considered? And the answer to that is we do review each application on its own merits. 3 reviewers will read the application and without knowledge of who else is advancing and whatnot. So geography doesn't have a bearing in this sense. And as you can see from the 20 prize winners that we do have, we have multiple winners from the same state, sometimes located very close to one another. So we are looking at each, we're trying to look at each individual community and their unique accomplishments. If anyone else has questions, we welcome them. You can just go to the control panel that we showed at the beginning of the presentation and click on the question box, and you should be able to type in your questions there, and we can answer them. Carrie, would you like to answer one of the questions we got before the broadcast?
Right. Yeah, another question, it came from a couple of directions. We know a great number of you are doing health improvement work in rural communities and are seeking information on funding opportunities for smaller population size communities with limited resources, and we certainly appreciate the unique challenges there that you face. Again, I would just say to be sure to sign up on the Advances newsletter, the RWJF Advances newsletter, for grant announcements. We'll also tweet out a few links to some resources that you may be aware of, but just in case you're not. There's the Rural Health Information Hub, ruralhealthinfo.org. They have a listing of funding opportunities that is regularly updated. I know the USDA has funding opportunities as well. There are national foundations, additional national foundations that focus on rural communities. I know W.K. Kellogg comes to mind. They have a Rural Places Initiative. One person also asked sort of a follow-up question to that in regard to mental health, illness, and behavioral health services for rural communities. And there's the APA, the American Psychological Association's Rural Resources for Rural Behavioral Health. So again, we'll send that link out to you. There's also, general grant-making websites. I think we've got that link going out too. So just some resources there. I would just add that the RWJF Culture of Health Prize, it's not a grant. It is very much an award recognizing communities where they are on their culture of health journey. So it is different that way, and we like to reiterate that so that people really appreciate the nature of this program, and also the importance of the communities that win the award. They are serving as ambassadors for building a culture of health and the movement that we're all working on together. So it is a bit different than a typical funding opportunity, for sure. Some other questions we have. Olivia, maybe, let's see, maybe you want to take another question here. I mean, do you have any additional advice for ways to increase the competitiveness of applications? I know we've talked a lot about strengths today, but anything else come to mind that we didn't have a chance to speak to?
Sure, I think we covered a lot of it today. Just always having those 6 criteria in mind is the key. We always like to see that, again, that it's a community-wide award, so we like to see that people are working together across sectors with multiple partners that are thinking outside the box and beyond sort of standard healthcare situations, but to larger root issues like the social economic factors. I will note as well as, a lot of people have asked for specific examples of proposals that have moved forward, and due to confidentiality, we cannot share any applications, but certainly if you haven't already, check out www.rwjf.org/prize, and the profiles of our winners so far. All of the communities that have won the prize are up with stories and videos about what they have done, and these really provide a great snapshot of the kinds of things that are compelling to judges, that are inspiring to other communities. They're things that other communities can learn from. So I encourage you to check out those stories.
Yeah, this is Carrie. I just wanted to build on what Olivia said. There are instructive tools that are newer this year. It's a new addition to the myriad ways that prize communities are featured, and so there's some real concrete examples and some infographics on that website as well, in addition to the videos. Well, we are not seeing any other questions here, but we certainly always keep our door open. Our email is on the screen. Please don't hesitate to call or email us if any other questions come to mind. And we certainly hope that you will continue to follow the RWJF Culture of Health Prize competition, consider applying in the future. Please do check out the community coaching available through County Health Rankings and Roadmaps. We hope you'll take advantage of the resources on that website, and we wish you the best for 2016. And thank you so much for joining us today. Take care.